Hello and welcome to the Wedding Dish podcast. Grab your fork and knife and take a seat at our table as we dish on all things weddings. You'll hear stories and tips from real couples and wedding pros about love, life, and entrepreneurship. I, of course, am Sarah Alapin, the host of The Wedding Dish and the CEO of Photos from the Hardy and District Bliss. And before we get started, if you haven't listened to last week's episode, you have to check it out. There's so much great information in there. Swing back around after you listen to this. So thanks everyone for tuning into The Wedding Dish. Today, we are dishing with a human with a passion for cosmetic dentistry. She cares deeply about prevention and patient education. I would like to welcome the owner and cosmetic dentist at Naomi Goldman Dentistry, Dr. Naomi Campbell, oh my God, Dr. Naomi Goldman. Thank you so much for joining me on the Wedding Dish.
Well, thank you for having me.
Dr. Goldman, I'm so excited to dish with you today.
Yes, me too.
Well, let's dive right in. We have a lot we're going to be talking about today, and I'm really excited about this because I think many of these pieces of cosmetic dentistry are difficult to really figure out what the timeline is, what you really need, what's the best option, and if you don't need anything at all. So I'm really excited. Thanks for joining me.
Yeah.
So let's start with whitening. What is the best way to whiten?
Okay, I get asked this all the time, as you can imagine. So really there's two types of whitening and two different ways to do it. So with whitening, you have your whitening that comes from whitening toothpaste, which is really just a surface stain removal. It's not true whitening. So whitening toothpastes are great for keeping your teeth looking good day to day. But if you want true whitening of the overall tooth structure, you need to use some sort of bleach. And so you can either do an at-home product, which does work, or you can do an in-office treatment. So just to start with the at-home products, the benefits are that usually it's less expensive, but you have to whiten consistently in order to see the results. And you have to avoid eating and drinking staining foods and drinks while you're whitening. And that includes like during the entire day, after you finish whitening. Like if you're whitening for a week, that means no coffee for a week, and 2 additional days after that. Because when you whiten your teeth, your enamel becomes kind of like more porous, so it will absorb stain easier than it would if you weren't whitening. It also helps the teeth to absorb the whitening. So that is a big drawback for a lot of people, and that is why people don't see results. It's because they throw a Crest White strip on here and there, and then they're just drinking coffee the next day, and it's just kind of like you're going back and forth. So most of my patients just come in for in-office treatment because it's just so much more convenient. And with in-office procedures, the downside is sensitivity. You have that also with the at-home strips. A lot of people have sensitivity with the at-home products, but the in-office treatments, a lot of them have sensitivity. In our office, we found one that doesn't. So we have so many patients coming in to do this in-office whitening. It really depends on the treatment that is provided and the products that are in that treatment. But yeah, long story short, the in-office whitening treatments will give you results a lot faster, and you won't have to avoid staining foods for so long. It'll usually just be like 12 to 24 hours after the treatment, and that's it.
I am shocked. I had no idea. Clearly, you saw my face.
Yeah.
I had no idea you had to avoid like any sort of staining. I mean, that includes like red wine, tea.
Yes,
I mean, there's so many.
Spinach, berries, like there's a lot of staining foods. We say anything that stains a white t-shirt. Like that, we call it the white diet. And it's like just think of white foods like eggs, mashed potatoes, cauliflower, chicken, like all of those things are good. Anything that stains a white teacher, no good. It's going to stain your teeth.
That's
While you're
wild. But I feel like they don't tell you that on whitening
no,
strips. Okay.
no,
It wasn't just something I
no,
didn't
they
know,
don't
right?
tell you that on the whitening strips for sure. Because then people just keep going to buy more, I guess. They're like, oh, I guess I just need more. No, this is just something that I've found over time, asking patients what they're using and like how it's working for them, seeing the patients that use certain products and why they're getting results when other people aren't. So yeah, all
That's
that.
fascinating. What about like when you talk about sensitivities? Okay, so I know that this wasn't like a question we discussed pre-show, but it brought up something for me, which is like you probably, regardless of which method you're choosing, need to see your dentist first, because if your teeth are not going to react well to Crest white strips or whatever the equivalent is, like you probably
Yeah.
need to ask a professional first.
I mean, I would say it's a good idea. There are some reasons, like if your teeth have decay on the surface, you don't really want to be whitening in there. You want to have nice, healthy teeth that can whiten. There are also some materials that don't whiten. So, like bonding or crowns, veneers, those things aren't going to whiten. And so then you may have some teeth that are whiter than others. There are also some teeth that don't whiten because of trauma. And so if I can usually pick up on those teeth pretty easily. So I always let patients know, hey, it's usually a front tooth because they get hit with a basketball or something. And I'm like, hey, I can tell that this tooth is calcified. It will not whiten. Or if it does, it's going to whiten very little. So then it's going to stand out more. And if they're okay with that and they want to do some treatment after the fact, then good. But otherwise, it's something that you may not be prepared for if you're whitening at home. Another thing that gets worse is white spots. Some people have white spots on their teeth and then they go to whiten and the white spots get worse. They're trying to hide the white spots and the white spots are getting worse from the whitening because it dehydrates the white areas and makes them brighter. So yeah, there's a whole science to whitening, and we do a lot of it at my office. So I am very familiar with all of the ins and outs of whitening. But yeah, there's definitely a lot of tips and tricks. I actually just put out a whitening guide on Instagram. So that is there, and that has all of that information in it.
Feel free to say your Instagram right now so people can go find that.
Yeah, so it's at Dr. Naomi Goldman. And yeah, it does. It has all of this information that I just talked about and more in it. And I put it out there for this exact reason, because a lot of people don't know why certain whitening treatments aren't working. And I just felt like it's so much more helpful for them to be doing things and not wasting their time and their money.
Yeah, I mean, that's super helpful. I mean, the worst thing you can do is like do something bad to your teeth that then you have to spend a ton of money to correct.
Yes.
Because you're doing something to save money or like damaging your teeth. I mean, I will get on my soapbox. I love going to the dentist because I think it is just one of the things that you can do for yourself that will like avoiding the dentist is like a self-perpetuating problem.
Absolutely.
So
you are a rare breed. It's good that you understand that. I'm always like, it's just going to get worse. If you're scared, it's just going to get worse. Just come in. But it's about finding a dentist that you trust, that you feel comfortable going to see, because I mean, not everybody has the bedside manner that can put someone with anxiety at ease. So
yeah. And if you've had bad experiences, which I recognize that I have not.
Yeah.
But yeah, I mean, so please consult your dentist, whether it's Dr. Naomi or, whoever is in your local area.
Yes.
So should couples be concerned about the sensitivity of whitening their teeth prior to their weddings?
Well, I would say the sensitivity only lasts about a day. So I would definitely not recommend doing a whitening treatment for the first time the night before your wedding, because I did this before my junior prom and I woke up in so much pain that like I couldn't even get dressed, because the feeling of putting my nails on fabric was like nails on a chalkboard for me.
Oh no.
My teeth were like, I wanted to pull them out of my head. So
Oh,
do not want to have that happen on your wedding day. Don't whiten the night before your wedding because you want to get like the best pop right the night before. Definitely do it like a week before. Let everything settle. Yeah, that is the best time. I wouldn't do it for the first time the week before, but for the last time the week before your wedding.
got it. Okay, that makes total sense. And how many treatments should couples expect to need if they're coming into the office?
It really varies. It varies on everybody's teeth whiten differently. And everybody starts at a different shade. So, depending on your starting shade, depending on how bright you want to get, depending on how your teeth whiten, depending on the strength of the gel, it really varies. I'd say most of our patients, I'd say patients in their 20s, 30s usually only need one or two treatments. Patients a little bit older, 40s, 50s, 60s, are going to need more just
Okay.
because time has darkened the teeth and the teeth become more resistant to whitening over time.
I was expecting like 8 to 10.
Oh, no,
So,
no, no. Definitely not. No, it works pretty well. A professional whitening treatment will work. But like I said, so will an at-home treatment. It's just a matter of being super diligent and understanding the science of whitening.
yeah, I mean, that makes total sense. And what kind of maintenance should people expect when whitening their teeth?
So again, everybody's teeth also darken at a different rate. It depends how much staining foods and drinks you're consuming. But I would say on average, a lot of my patients come and do a whitening treatment with their cleaning. So some do it every 6 months, some do it once a year. But whitening does require maintenance because your teeth will absorb stain over time. And I have had some patients that said, I whitened my teeth professionally 20 years ago and they're still bright white. And those are the rare exceptions. But most people, I know for myself, I have to whiten at least once a year if I want them to stay bright. If not,
Okay.
they're not going to get super dark, but they're not going to be like popping like I like. So,
Yeah, that makes total sense. I mean, I guess it also depends on what you eat. If you're eating the white diet, the white t-shirt diet,
yeah.
then
I mean, I don't think anybody wants to live on the white t-shirt diet. So I would say just spend the money to whiten here and there and eat what you want.
yeah, I tend to agree.
Yeah.
And okay, let's talk. We talked a little bit about how far in advance people what you would recommend whitening. So,
Mhm.
knowing that they have potentially 6 months of their teeth being close to the same shade of whitening, what do you recommend for how far in advance of the wedding?
So I would say give it a few months because then you just have time. So if you do a treatment a few months out and you're like, oh, like, I didn't get as bright as I thought I was going to get, then you have time to repeat the treatment. Um, and if you whiten once and you're like, oh, great, my teeth look amazing, then maybe you just want to schedule one for 1 week before the wedding just to get it to pop again one more time. Or maybe they look amazing and you're like, okay, I'm done. But I'd say sooner is better, just so you understand what your teeth are going to do, and you have time to correct if it doesn't work like you thought it was going to work.
Yeah, that's super true. Like if you have that time to correct, also, the sooner you do it, the more wedding related events your teeth look amazing
Yes,
for. So,
exactly. We know there's a lot of those.
like all the photos with
Yeah,
like your family while they're celebrating and all the
right.
things.
Yeah.
So, alternative to whitening, or just in general, if people are looking into veneers, first of all, can you define what veneers are for anyone who may not know?
Yeah. So, in my world, there are two types of veneers. I know most people, when they think of veneers, they think of the porcelain veneers that Hollywood celebrities would have. And they're just basically a layer of porcelain that is cemented onto the surface of your tooth. And they can be made any color, any shape, size. but you do usually have to remove some of the enamel on the surface of the tooth. In most cases, it depends again on the specific case, but I'd say 90% of cases, a dentist is removing some enamel. So that is the first type. And then there's a newer type of veneer that some dentists are doing, which is a composite veneer. And that is your white filling material. So basically, in my office, these are my conservative type of veneers where I do not remove any tooth structure, unless there's a tooth that's really rotated and like not in alignment. But for the most part, we don't remove anything. We basically just scratch the surface and bond the material right over the front of the tooth. The one caveat with that is that you usually have to treat more teeth because it's completely additive. And so those teeth that we treat end up being more forward than the rest. And so you have to treat the teeth that you see when you smile, usually 8 to 10 teeth, so that everything looks nice and even. It does create like a really beautiful, broad white smile. And it's completely non-invasive. So that is a big draw for most people. But it usually ends up being more expensive than porcelain because you have to treat more teeth. A lot of people come in with porcelain and want, 2 to 4 veneers to fix a space or just to add a little length on their front teeth. And most of the time you can't do it with composite. So, but yeah, a veneer basically is just a layer of material that you put over the front of a tooth to correct something about the tooth. It can be color, it can be length, it can be sometimes position, it can be shape, or it could be all of those things.
Okay. So essentially, it sounds like you don't have to shave down teeth if you're using the composite versus the porcelain you do.
Exactly.
Okay.
In general.
Yeah.
Yeah.
But all of this is blanket. Like everyone has their own mouth that has its own things.
Right. Yes, exactly.
As with anything medical.
Right, exactly.
Please see your Dr. Goldman. So when do you recommend composite versus porcelain veneers?
Oh, it's like I actually put a post out about that too because I get asked this question a lot. So a lot of patients come to me because I do composite veneers. They come and they say, I want veneers. I don't want to shave my teeth. Okay, well, then I recommend composite. They're coming to me for that specific reason. And a lot of them have beautiful, healthy teeth. And for me, I don't want to touch their teeth. I don't want to do any damage, even if it's minimal to their teeth. So I love that option because I feel good about it. And at the end, they walk away with a smile they're more confident about for whatever reason. And their teeth are still under there. So it's technically reversible, although no one has ever asked me to reverse it. And then with porcelain, a lot of my cases are the single dark front tooth. Again, the one that was traumatized. I usually put a porcelain veneer on that because all I'm trying to do is blend the one tooth in with the rest of the teeth in terms of the color. And so for that, it's easier just to remove a little bit of the enamel and to custom match a veneer that matches the rest of the teeth. I would also do that if a patient came in and said, I just want my 2 front teeth changed. I just want them a little bit longer, or something like that. So when it's fewer teeth, I usually recommend porcelain. There are some other cases. If a patient already has something that's porcelain in the front, like they have a crown or another veneer, I say go with porcelain. Or if they have porcelain veneers and they want to replace them, you have to replace it with another porcelain veneer. So hopefully that answers the question.
That makes total sense. Okay. So is there a difference in maintenance and longevity with composite versus porcelain?
In my hands, no. It varies though, because porcelain is like the standard and composite is the newer technique. Composite, it really matters what you use, what material is used, and how you place the composite on the teeth. And there are so many ways to do a composite veneer. I've seen so many different doctors do it 100 different ways. And I'm sure that the ways that they're doing it are working really well for them. The way that I am doing it is working really well in our office. And I see the strength comparable to porcelain. And porcelain was the original gold standard of strength for veneers. So now we've found a way to make the composite similar in strength to porcelain. And then the other question with composite was always staining. And so the material that I use in my office does not stain over time. There's been a lot of studies that as long as it is polished properly, it doesn't stain over time. It really maintains its color. And that was always the thing with porcelain. Porcelain doesn't stain, but composite stains. Well, as long as you're using the right material, it doesn't stain. The benefit with composite is it's repairable. So porcelain, if you were to chip a porcelain veneer, you have to replace the porcelain veneer. There's no patching it. With composite, you can add to it. So if you get a cavity on the tooth, or if you get a little bit of gum recession, or you chip it, it's repairable. You don't need to take it all off and redo the entire thing.
Oh, that's interesting, because don't your gums kind of, maybe not everyone's do, but don't a lot of people's gums recede as they age?
Yes, a lot of people's do. Mm-hmm. Okay. Yes. And that is one of the reasons why a lot of people get their porcelain veneers redone, because of recession. So a good porcelain veneer can last 20 to 30 years, but usually in 20 to 30, if you were 20 or 30 when you got your veneers, your face just doesn't look the same at 60 as it did at 20 or 30. So yes, you have the teeth have shifted, or you've gotten recession, or you've gotten decay, or something is likely to happen in those 30 years. And then you need them replaced. So, and probably the same goes for composite as well. I don't think anything in dentistry is meant to last your entire life. So there is usually a point in time when you replace them. It may not be all at once, and you may choose to repair them instead. But that is something that I find a lot of patients say is like, okay, so this is permanent. It's going to last the rest of my life. I'm like, no, unfortunately, it's not, because there are so many forces going on in your mouth, and things will wear down over time. So,
yeah. I mean, it's kind of like if you have a cavity, like your filling eventually is going to wear down and need to be updated. Your mouth is doing a lot of
right. It's just like a car. Like, you wouldn't expect a car to last for the rest of your life. You know, there's as much as you're maintaining the car, it's just not meant to last forever. So it will eventually break down.
Yes.
Similar to restorations in dentistry.
Although, please see your dentist and talk to them about how you can have best teeth practices.
Yes. Obviously, the better maintenance you're doing, the longer things are going to last, for sure.
Yes. Yeah, that makes such a huge difference. I'm such an advocate for going to the dentist.
Yeah, you clearly are. I love that. I love that.
I mean, it just makes your life so much easier long term.
Right.
And, you know, you don't have your maintenance is so much lower. It's like getting your oil changed. Like, change your oil when you're supposed to change your oil so that you don't
have problems.
Yes.
Yes, exactly. Another thing I would add is, on the preventative side, is straight teeth. Straight teeth prevent problems. Again, like using the car analogy, if you have, everybody understands, like, your tires need to be aligned, because if your tires aren't aligned, then everything's going to wear down unevenly and faster. And so it's the same thing. Like, your teeth function like a machine. And if you have teeth that aren't aligned, that aren't, biting up and down, you're creating chipping, cracks, you're creating notches. Your teeth will start to wear a lot faster, maybe on one side than the other. And then you lose a tooth, and now you're functioning on less teeth on one side. And then you can just see how it's a domino effect. they also tend to have more problems with inflammation and bone loss and decay because you just can't clean them properly. It's just amazing when you look at someone that had really crowded teeth and they had all this inflammation and they really weren't taking care of them. And then all you do is move them into the right place. And all of a sudden, everything is healthy because also the patient wants to take care of it. They've just invested in their teeth. But like you just see the entire picture, everything is better. And that will prevent breakdown for the patient's lifetime. Like that is the key. Having straight teeth that function well, that is the key to preventing problems in my mind.
I love this so much. You are validating all of my personal feelings.
Yeah.
Speaking of having your teeth inlined, let's talk about Invisalign. What is a typical, what does the typical adult care treatment look like in terms of length and cost for Invisalign?
Okay, so this will vary also by provider. I can tell you my experience with it. In my office, the typical length of treatment for my patients is 4 to 6 months. And that is pretty short because of the type of patient that I treat. I don't treat very complicated cases. I would say I treat mild to moderate crowding and spacing. Most of my patients have had ortho in the past, as a teenager, and then their teeth just relapsed and became crowded again as an adult. So I would say that, that is a specific type of patient that I'm treating, and that is why the treatment length is on the shorter end. And then the cost in my office usually ranges from, say, $4,500 to $6,000. And again, that's because of the case type that I am doing. I've seen more complex cases go anywhere from, 6 to 8,000. So a lot of those though are like first time orthos teenagers because it's just much more complicated. You have growth involved and all sorts of different things. So just understand that treating an adult is very different than treating a teenager that is growing and you're managing 2 sets of teeth. You got the baby teeth, you got the adult teeth, you're making room. It's a whole different ballgame. So yes, in my world of adult ortho, 4 to 6 months, average case, $5,600.
Okay, that makes sense. And just I have to get on my soapbox one more time about this, but please wear your retainers or whatever it is afterward.
Yes.
I still wear my retainers they've been updated, but like from high school.
Yeah.
And my teeth have barely shifted at all.
Yes.
And that it just like
retainers are for life, for sure.
Yes. I cannot say this enough. It also protects your teeth at least minimally if you have a night where you grind. Of course, if you're grinding regularly, and of course you can say more about this than me, but it will like at least minimally protect you if you have like a nightmare where you're grinding, that kind of thing.
Yeah, for sure. I mean, there's definitely a barrier there between your teeth, so it will protect your teeth. But if you're a grinder, you're just going to break the retainers over. You'll know. You're going to break them. So then you just need something thicker that's going to hold your teeth and, help protect against grinding or clenching. Most women, I'd say, are clenchers for sure. That's what I see.
Honestly,
the men are the grinders, the women are the clenchers.
That does not surprise me at all.
Yeah. For sure. We hold it all in our dress. Yeah.
And it all comes out at night.
Yeah, it all comes out at night. Yes, exactly.
This has been so much fun, Dr. Goldman. Thank you so much for joining me on the Wedding Dish podcast. Where can our listeners find you online? And actually, let me add in, where can our listeners find you physically? Because obviously what you do, you share a lot of content and education online. But if people want to visit you so that they can have a consult or get any of these procedures done, if you could just tell us your city location, that would be great.
So online, on Instagram most often. So that's at Dr. Naomi Goldman. I do answer all messages on there. I reply to all my comments. So you can definitely ask me anything and get a hold of me there. My website is levygoldmandentistry.com. And on there, there's a link for a virtual consult. If you are in the area and you want to submit a virtual consult, it takes about 5 minutes. That's like super helpful for a lot of people. And I'm located in the North Shore of Boston in Peabody, Massachusetts.
Oh, lovely. You are about to go into a beautiful season
Yes.
up there.
Yes. I love this season. Yep.
I bet fall is your favorite season.
Mm-hmm. It is so nice.
Yeah. Oh my gosh. Well, this has been so much fun. Everyone, we will link out to Dr. Goldman's Instagram website so that you can follow her and get this information, schedule a consult if that's the right fit for you. And while you are looking her up, you can find us on Instagram at the Wedding Dish Podcast, and our show notes will be at the weddingdishpodcast.com, so you can get more information about Dr. Goldman and her practice. I really loved reading about your passion for education and prevention. It's just such a spot in my heart, clearly.
Yes, clearly. I love that. I love that.
Everyone go to the dentist. And we will see you all next week. Thank you so much for joining me today, Dr. Goldman.
Thank you so much for having me. It's been a lot of fun.
Yay! Until we meet again, everybody. Cheers.